In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
Joining me in the studio today is Dr. Falk Schwendicke, a preventive dentistry expert at Berlin's Charité Hospital. Hello and welcome to In Good Shape. When you look at the report, the root canal work looked very, very complicated. Does the tooth actually survive the procedure?
The tooth itself survives the procedure, yes, it's retained in the mouth. But the root canal system is usually filled by a nerve and blood-filled tissue, and that is removed. So the tooth itself is there, but it's dead, it's empty inside and filled with an artificial material.
Okay, so but if the tooth is dead, why doesn't it fall out?
Because the tissue around it, the periodontium, as we say, so fibers and bone, which retain the tooth, that's still intact, that still works, and that's why the tooth remains there.
So it's just the cover of the tooth and there are no nerves in it, there's no blood vessels in it. So do you have any feelings, any sensations inside the tooth?
In the perfect situation, you shouldn't know, because all the tissue which can transport feelings, the nerve tissue, is removed. So you shouldn't feel anything, no pain, and you wouldn't also feel caries or these kind of things, not at all, no.
Yeah, which is good on one hand, because you don't have any toothache then, and you don't have to go and see your doctor because it's painful. But on the other hand, there's no warning sign.
Exactly, that's absolutely true. There's no warning sign. Well, that's a general problem with caries. The most caries lesions don't hurt. That's why patients often notice them very late. And that's when they come, and usually we can't do that much in most cases any longer. So what I would suggest is go regularly, see the dentist. He takes an X-ray every 1 or 2 years, depending on your interval, and then you can be controlled for caries, but also for infection and inflammation in that tooth.
But on the other hand, when a tooth which you repaired with a root canal surgery, if it gets painful, what does this suggest?
It can suggest several things, but if you look at this root canal treatment, we saw it, it's very difficult. It's a very complex system which we have to shape, to clean, to remove all the bacteria from, and that does not always work perfectly. So in some cases, bacteria remain, and that can cause inflammation, that can cause infection, that can also cause pain. And that's, I would say, the most frequent reason why such a root canal treatment doesn't work perfectly.
But why is this so difficult to clean out every canal?
Because it's a biological thing, such a tooth, and it's not perfectly standardized. So it has a certain amount of canals, which we don't know in advance. The canals are irregularly shaped. We are basically working in the blind, in the dark. Some of us work with a microscope or anything. But nevertheless, it's difficult to see and to feel all the canal and to perfectly clean and shape it. That's why we can't reach all the areas, and sometimes that's a problem because of the remaining bacteria.
So if it's so difficult, I mean, it's difficult for the patient as well, because it's a painful, long procedure, and it's difficult for the dentist. So why do you even bother to repair the root canal and clean it out? Why don't you just pull the tooth?
I think there are two reasons for that. The one is that technically we have the option to retain the tooth, to do a root canal treatment with good success rates, and also dentists these days have these abilities. And on the other hand, and I think that's even more important, patients demand that from us. I think our feeling, what we want, what kind of teeth we want to retain, has changed over the time, and patients want to retain their own teeth. They see this as part of the whole mouth, and a very holistic and biological approach, and so patients and dentists together often want to retain and keep the tooth.
For ages, dentures were the solutions for teeth loss. Nowadays, there are implants. But what disadvantages do implants have?
I think they have two disadvantages. We can't use them in all situations. So, for example, for medically compromised patients, patients which have some kind of problems with bleeding, or also patients with, for example, a radio after a radiation. These patients, they have difficulties getting them, and also the bone amount where we place the implant in needs to be there. So there are some situations where it's not possible to place implants, and on the other hand, implants are more expensive than normal dentures. That's why also the financial situation is often something which speaks against an implant.
So what do you mean by bone amount which needs to be there? Is it if there's not so much bone around, you can just plug it in?
Exactly, because the implant, as we saw, needs a certain amount of bone to rest in and to be stabilized by. And if that bone is not there, we have a problem because we can't stabilize it. You can rebuild that. So there are surgical techniques to rebuild and gain bone, but only to a limited degree. So in some situations, it's not possible to provide implants now.
So if you put an implant successfully in, how long does it usually last?
That depends. For, I think, several decades we thought, okay, the implant might even be the better tooth. It can last for very, very long. But we've learned that especially biological complications are a problem there. Implants can get a similar disease like periodontitis, so like tooth, they can get an inflammation around the implant itself and the tissues and the soft tissue and the bone. And that inflammation is not that easy to cure and probably limits in some patients the durability of such an implant.
Is there some special care a patient has to take care of to get the implants last forever?
As I said, for teeth, you have the risk of periodontitis and caries. Okay, an implant can't get caries, so that's already solved. But for periodontitis, you would try to clean as much as possible. You would use flossing or interdental brushes, and that's something, especially those brushes, they might be slightly different, but you would use them for implants as well. And your dentist or the dental hygienist would exactly tell you how to clean an implant, yes.
And is the thing with the implants the same like with gum disease in normal teeth?
It is very similar. We know that the biologics behind it is slightly different, and especially the therapy is very different because the implant is a rough structure. That's how it's retained in the bone, so it's very difficult to clean by the dentist, and that's why we have the problem with that peri-implantitis. It usually goes quicker and deeper than a normal periodontitis, but in basic, yes, it's similar.
Okay. We got a lot of viewer questions. Let's just ask you some. Jackie Sinkovich from the US wants to know about oil swishing. Could you just explain what oil swishing is and if it's useful?
The idea behind it is that you basically swish and swirl with the oil in your mouth and you place it on all the tooth surfaces so the bacteria can't adhere to that fatty film. It's a nice idea, but it hasn't been proven to really work, so I personally would rather spend my time, instead of swirling and swishing with the oil, by brushing my teeth or using floss or that kind of stuff.
Okay. Aura Ron from the US asked several questions. One of this was, when will we be able to print our own teeth in a 3D printer?
That's an interesting question. I think we are already quite far into that process when it comes to dentures and crowns. So it's nearly a standard technique, digitally designing crowns and printing them. It's not really printing, it's milling, but it's similar. For whole teeth, I think it will be still a while from now, because teeth are very, very complex. They are very complex structures, so I think we are still some time away from printing whole teeth.
Another question Aura asked us was that she has ceramic fillings that fall out every few years. Does she have any alternatives to the ceramic fillings?
I think if you place such fillings, ceramics or composite fillings, they're usually glued into the tooth, and that should work. And so there might be a reason why this doesn't work. It might be the gluing process, for example. But basically there are alternatives, but I would rather try to re-glue it in a proper way so that it sticks.
And see the dentist.
Exactly.
Dr. Schwendicke, thank you so much for being with us today in the studio. Thanks and goodbye.